the idea of utilizing touch, which is what havening anchors into, is gentle, mindful touch to create long-term change. As a scientist, for me, and somebody who's trained in psychotherapy, touch is not a part of the therapeutic process, was so bizarre. But after living with very severe PTSD for 5 years, when a colleague of mine mentioned this modality where you rub your arm, give yourself a moving hug, and sing some songs and do different protocols to heal trauma, I was desperate. And that's in a very high level way what havening is. That's actually the event havening protocol, is using distractions plus mindful touch to depotentiate neurons that are encoded in the amygdala. It's a science thing that happens. And it's incredibly effective. So after 5 years of living in very severe PTSD, and I write about this in the book, the guy I was dating casually, who I'm now married to, at the time, saying, well, I've got miles and I can set you up with a hotel room. Do you want to go to New York to try this thing? I was like, oh, I guess the universe is telling me something. And so I went to my first havening training, and it was transformative. I never anticipated that there was the possibility that there could be something that so directly depotentiates or turns off the encoded neurons in our amygdala that are causing the trauma symptoms. And for many of us who live with PTSD, it's like there's something that's just super glued onto our brain. And it's like if we just get that one thing to go away, if we just turn off that light switch, we can get our brain back.